name is Ted Vanderkooi, General Surgeon with Muskegon Surgical Associates. Are you sure you don't want any more kids? If the answer to that is yes, vasectomy is a very good way to go. It's quite simple to perform in the office. Patients are very comfortable with local anesthetic. The office environment is friendly, warm. We can put you at ease. The good part about a vasectomy is it's not as invasive as other means of contraception as your wife would have to go through, and it's permanent, at least as permanent as we can make it from a surgical perspective. In regards to having sex and ejaculating, all of those functions are completely normal. The sperm make up a very, very small percentage of what's present in the ejaculate. So men can experience the same feeling, and there's really nothing that changes physiologically after having a vasectomy. Surgery itself, you come to the office, we make you comfortable laying down, and we can numb up the scrotum really quite easily. The scrotum doesn't have much feeling. Once the numbing medicine is in, it numbs up really the structures that go to the testicle. And the structure that needs to be divided is called the vas deferens. When we do the surgery, we use one incision at the top of the scrotum, and through that one incision we can get at both sides. So we can get at both vas deferens through one incision. It takes about 30 minutes in the office from start to finish. By the time you come and by the time you leave, it's probably more a 45-minute process, but the actual surgery is usually less than 30 minutes. The process of putting in the numbing medicine can be what guys fear the most. But having done this for over 20 years, that is something that can be very tolerable. Yeah, once the numbing medicine is in, it's very well tolerated. And even the process of putting it in is not that hard because the scrotum doesn't have much feeling. It's very different than your fingers or your toes or anything on your face. After surgery, we want you to lead a pretty normal life, kick back for a few days where you plan to put your feet up and rest, and you're not out playing football, something of that nature. But for the average man, getting back to work is no problem in 2 or 3 days. And post-op, most guys just use some Tylenol, some ibuprofen. It's sore like any cut that you might have. It's sore for a couple of weeks. You'll know you've had something done. But just take some ibuprofen, some Tylenol, and you'll do very well. Another thing that can help is crushed ice. And in fact, it's not mandatory you have ice, but some guys feel that this helps and is beneficial. We do have you submit a sample to prove that you're sterile within 6 to 8 weeks. It often takes that long to clean the pipework to be sure that there's no sperm available. Sometimes it does take longer, but typically after a couple of months, birth control can be stopped. Now, every surgery does have some risks. There's some chance of infection, some chance of bleeding. There is some chance that the ends of the vas find their way back together. And looking at the literature, that possibility is between 1 and 5 in 1,000. So it's not impossible, but it is a very low chance.